Let us now go to pulse taking. The topic is floating pulse. The normal pulse has the following profile. It is equally palpable at all three positions. Its pulsation comes and goes evenly and is moderate in force, and it has a regular rhythm and an even rate of 60 to 90 per minute. The pulse profile may vary in response to external and internal influences on the body. For example, in a baby, the normal pulse has a faster rate than that of an adult, and in a woman, it has a slightly faster rate than that of a man. In summer, because of the higher ambient temperature, the blood vessels dilate and blood flows faster, so that the pulsation comes more vigorously and goes gently. In winter, because the ambient temperature is lower, the vessels constrict and the pulse is deeper. In a thin person, the pulse is more superficial, whereas in a fat person, the pulse is deeper. A pulse may be abnormal because of its depth, rate, rhythm, volume, or force. The context of pulses of abnormal location refers to the depth at which the pulse is palpable and the length of radial artery over which it is palpable. The profile of a normal pulse is that it is palpable at all three positions of Guan, Chun, and Qi, and at the depth that is neither superficial nor deep. The floating pulse is palpable at a superficial depth, requiring only light touching. With increased pressure, the pulse shows a diminution in the force of its pulsation, but there is not an empty field. The ancients used the metaphor of wood floating on water. The clinical significance of a floating pulse indicates an illness in the exterior and is mostly seen in the initial stages of an exogenous illness. A floating but forceless pulse indicates an illness of deficiency in the exterior, mainly a contagious febrile illness with much sweating or attack by exogenous evil and physical condition of yang deficiency. A floating but forceful pulse indicates an illness of strength in the exterior, mainly a contagious febrile illness without sweating. A rapid floating pulse suggests an exogenous heat illness in the exterior, while a tight floating pulse suggests an exogenous cold illness in the exterior. A floating pulse is also seen in a patient weakened by chronic illness so that yang qi floats to the exterior of the body, in such a case that the pulse is characteristically floating and forceless. In addition, the pulse may become floating in a patient taking certain drugs to dilate the airways. In this case, the floating characteristic is transient. The principal factor in the formation of a floating pulse is exogenous evil qi. When evil qi attacks, nutritive yang resists it and excites meridian qi in the exterior, hence the floating pulse. If genuine qi is deficient and weakened yang qi floats to the exterior, the pulse may also become floating. In that case, it is forceless. A floating pulse could be feeble, forceful, rapid, or tense. The characteristic of a floating and feeble pulse is just below the surface that is felt with light touch and becomes faint on pressing but does not feel hollow. The analysis is defensive yang expels evil qi and keeps meridian qi in exterior. Deficient genuine qi allows weak yang to float, producing floating and feeble pulse. The clinical significance is deficiency illness in exterior with fever and sweating, or exogenous illness and physical condition of yang deficiency. For floating and forceful pulse, the clinical significance is strength illness in exterior with fever and little sweating. For floating and rapid pulse, the clinical significance is exogenous heat illnesses in exterior. And for floating intense pulse, the clinical significance is endogenous cold illnesses in exterior. Thank you so much for your attention.